Thanks a lot for the opportunity to come and talk here. And because I engage in teaching, I have a tendency of going beyond my allowed time, so I'm going to keep my time. So just to help you out. So my name is Soorej, and I have various hats. And today I will be wearing the one predominantly with the WHO, what I work with on migration and health. Specifically focusing on detention. So it was great that you spoke before me. So you got a real nice general background and we can dig a bit deep. Now we'll talk about the global context, European context, not EU, but European context, but then diving a bit into the Swedish context. So sort of trying to take that line. And I really like sort of the title of the day today, not my presentation, but the theme of the day, and highlighted the politics part in red. And this is, I assume this is what you're referring to, the social determinants of health and what causes ill health. I am trained in global health, and what I often teach is that health often should happen outside the hospital. It's only when things outside the hospital does not work, people go to the hospital. That's when you get sick, you try to seek care. So what Chloe referred to as social determinants of health, that's predominantly what I'll be talking about from a detention perspective. So I don't know how fast and how slow I'll speak, but I thought I'll take the key messages first in case if I don't manage to finish my presentation. So I have been working on detention for more than a decade across Europe in a lot of other countries. Regardless of what we think, what we like, and it's up to us to define who we are, this has become a vital part of migration management strategy. And based on what I've seen so far, based on what I've been involved in so far, this is not something that is going to end soon, unfortunately. So it's very important while we educate to ending detention and not using it, it's also important to address what happens in detention. And that's partially got a lot of my talk will be focusing on what happens there and what can be done, if anything. And then there are a lot of vulnerable groups, children among one of those, and there are rights convention, other things, and there is this one convention say that children should not be detained, and we have plenty and plenty of evidence saying that no, it's happening. Sometimes regular basis, somehow ad hoc basis, but they're detained, and that should be avoided, and along with other vulnerable groups. And the next point is more of a general point, like why should we care for migrant health? And I usually have this with my students when I have, or with others, audience I have. And of course, the answer is simple. Why should I care for my health? It's the same reason. Why should we care for migrants' health? But from a pure public health point of view, and I think COVID is a wonderful example, a lot of other examples we have, nobody is safe until everybody is safe. And if you take the example of communicable diseases, and I often say that a virus or a bacteria does not look at your passport before infecting you. So from a pure public health point of view, it's important to take care of the health of the people that are within your borders, if we go with the national border, that concept. But also from a human rights perspective, one of the main human rights is right to highest attainable standard of health. And if you have limited access to care on purpose, or it could be happening consciously or unconsciously, we are not fulfilling the human rights. And then it's on the question, do we really intend to? That's another discussion. But based on just to these points, and there are several other points, it's important to care for health of migrants, and even more for care for migrants who are put in such situation by the rules and regulations. So they're not put in there by themselves, but it's the rules. So it gives us more responsibility. And the last point, which I will not talk anymore after this, is about alternatives to detention. We understand, I can't say I accept, but we understand this is a practice that's going to exist, detention. But meanwhile, it's equally, if not more, important to explore options to alternate to detention, meaning not locking up people. And there are various forms of it, not going to go through it. But before I go to detention, I'll talk about social determinants a bit. This long text, don't worry, just look at the bold text. So it's basically the conditions where people live and work. And then the next bold part, it is those conditions that create inequalities in health or ill health or disease. This is another way of putting that. So you have the individual right there in the middle over there, and you have your basic factors, your gender, your age, and genetics and other kinds of things. And then you go up each and every ladder in the society. You have a lifestyle, you have an immediate community, then you go to the municipality or the county level, then you go to the national level, and then the global level. To me, the most interesting part in this is, except the immediate inner circle, everything else is modifiable by policy. Age, I don't think we can change. I mean, yes, we can pretend to change, but we can't change by rules and regulations. Gender, in some contexts, it's possible, but widely not. So that's why I kept the inner circle out, everything else. And that's where the determinants of health comes into play. How does policies create ill health, which is the theme of today's. And I think detention there are many other examples. I think detention is a wonderful example just to discuss on that part. So if you look in the migrant context, what are these various non-health policies? You have entry requirements, who get to come. Chloe mentioned the example of Australia. There is another example from Australia, for example. Even when you are a quota refugee, that means you are allocated the numbers based on UNHCR and your collaboration, then the countries still go and choose whom from the quota I choose. And what are the criteria? I'm not going to name any countries, but there are countries here that if you have tuberculosis, not going to take you. Go get treated, be healthy, then I can take you back. Or not take you back, take you. Then there are countries in Scandinavia who said, not going to take certain set of refugees because it will be a burden on the social system. So that's an example. Or right now we have rules and regulations on what kind of salary you should have to get a permit, how long can you stay. So things like the entry and visa requirements. Then who gets access? What is a pathway to gain citizenship? Is it based on language requirements? Is it based on knowing history of a country 50 years ago, 100 years ago, 150 years ago, or is it something else? What is the requirement for those rules? What are we trying to achieve? So is it facilitating? And we also know not being a citizen, it comes with both responsibilities and entitlements, but that's sort of the inroad to the system, being part of society, contributing while benefiting, if I could say so. And how do we restrict that? Dispersal. Where can we stay? Can I stay where I would like to in the country, or should I follow, like, instead of saying in Malmö where I have friends and colleagues, now I should go and say in Haparanda? Who decides that? What impact does that on health? Another one is language training. Who have access to it? Like in Sweden, asylum seekers do not have access to SFE, the language training session for foreign asylum seekers. And is the asylum procedure 1 month long, 2 months long, couple of years long? What happens? How well that person will be integrated to the society if that person gets a protection. And then we have labor market policies, what kind of work can engage, what is the minimum requirement. We have several cases where the employee is deported because the employer failed to pay some amount of the tax. Then the one is on forced return policies, the detention, that's where we sort of come into play. So we have the 4 phases of migration. The green one is where you are in your home before you depart, and then the orange one is the transit phase. For some of us, most of us actually, it's for 2 to 3 hours in Frankfurt, Heathrow. But think about people stuck in Libya, days, month, years, Syrians in Turkey. So that could look really different. Arrival and integration phase. Depends if you ever reach the integration phase. You might actually arrive and then be deported back. It could be 1 month, it could be more than that. And then some people actually tend to return. Some people then tend to actually go forward. Detention actually predominantly happens in the arrival and the transit phase. It can happen in the other phases, but predominantly in those 2 phases. So just to situate where in the migration. And the sort of the blue arches you see there, these are what I call as social determinants of health at various levels. So each and every phase, the determinants have an impact. The policies, all of other examples I gave. Now, what is detention? There are various definitions. This is one of the things that is widely used, and I actually admire Chloe used the word punitive quite a lot, and it is actually the case, how they experience, but legally it's on purpose, I would say. It's called non-punitive and administrative. In the Swedish context, they say that, no, this is part of the administration law, so you're not criminal. And one of the articles I wrote on the experience of migrant detention was, it's a prison with extra flavors. The question comes, I don't commit any crime, so why am I locked up? So the response is, yeah, you don't commit any crime, you're not in a prison. But then they experience it as a prison. What does that do? Is it just a way of saying something? Or is it how you experience, and what does that have to do with health? And the idea is that you restrict the liberty of a person to implement another administrative procedure, often verifying your identity or deportation, for example. But the UN Committee Against Arbitrary Detention saying that any form of incursion of liberty is detention. It's very important to understand that. For example, if you have an open reception center, say that you're free to leave whenever you want, but you should be back here by 6 until 8 a.m. next morning. By definition of the UN committee, it is detention because I am restricting your liberty. If you have an anklet on your foot saying that you can leave within the 5-kilometer radius, I'm not locking up anybody, but I am. That is detention. But to clarify, I'm not going to talk about those kind of detention here. I'm talking about people locked up in buildings, as it is. So why are people detained? The EU law sort of says these are the sort of the basic 4 reasons, if I could summarize, and these look differently in different EU member states. In the Swedish context, I would say predominantly it's the last 2 that is quite widely used to prevent absconding while you have a case against you or why there's a deportation decision against you, or that the migration agency or the border police seems, for their own reasons, that there's a risk that you might go absconding. But I've been to several EU countries where the first 2 is very widely used. And like in the border, you come in, you're detained because we are not sure of your identity, and then you can apply for asylum. Or we would like to detain you to make sure that you don't have tuberculosis. Is that for 2 days? Is that 1 week? Or there are also several EU countries where children, especially unaccompanied minors, are detained together with strange adult men and women until their vulnerability is being assessed. So it varies from context to context. In the Swedish context, it's the last 2 points that's more relevant. And then we have the issue of automatic detention. That's the one I said. You come in. There are countries, if you come in via certain means of transport, let's say by sea, you are detained. And after that, we can talk. Technically, you're crossing a border, then you should apply, and then the procedure should happen. But it's the other way around. And then in any document, legal document, or any guidance you take, it's always this word mentioned. It should be used as the last resort. But who decides when is the last? When is the end? And is there an individual case analysis happening? I would say not often. And it varies from prisons to hostel-like structure. I've been to several EU countries and other countries. Like I would say in Sweden, the context looks like it's a hostel where you're locked up because it doesn't have a prison physical resemblance. The physical part is quite important. It looks like a corridor and several rooms. It's like a vandrarhem, a hostel in that sense. But then I've been to places where you have big dogs guarding the place outside detention. There have been places close to major European airports where there are razor wires which are electrocuted with electricity. And it is prison. Some countries old prisons as it is, but don't mix criminals with migrants. But it's so then the prison feeling comes into play. And then there are places where I've been to, they have been on islands. The only way there is one bridge and then it's the island and then all detainees are there. So it varies. So it's difficult to draw one line and say this is what detention is. It could look different. So in the EU, it's mostly run, I said mostly, it's run by government authorities. Some places it's also run by private security companies quite often. And there comes the duality, who employs the healthcare worker, who are they answerable to. And then the average duration varies from 6 to 18 months. In the EU context, 18 is the maximum allowed limit for one instance. I can release you and I can detain you back for another 18 months. For one instance, its max is 18. Sweden had 12 months. It changed to 18 months recently. Some countries like the UK, there exists no legal limits. I can be detained how much ever time the government would like to. Australia is another terrible example. And then you have specialized facilities, the examples I gave, and there are various kind of categories of people work there. And in the EU context, predominantly, it's asylum seekers, irregular migrants or undocumented, and Dublin cases where you'll be sent back to a European country. But there are instances, like in some refugee camps, you're closed off. You're not allowed to leave that camp. If you go back to the previous definition, that is detention. Healthcare ranges from emergency care. In Swedish context, they have the right to care that cannot be deferred, often sometimes wrongly interpreted as emergency care. And in other cases, they would have a bit more care in other countries. In Sweden, we have the migration agency. They have around 600 places. This has increased. Previously, in 2015, it was 250. Now it's more than double. The aim is to bring it up to 900 plus facilities. Detention staff, we have the case officers, It's handledare, handläggare, and OS-handläggare. I'm trying to get the English words. The social officer, the case officer, and the social officer for activities, we could say that. And it's a county council and the right to care that can be deferred. And NGOs do have access, but they do not provide any healthcare service. They provide psychosocial support there. Now, these are the various health consequences, and I definitely cannot go through all of it. But I just categorize into various sections. And there are a few things I would like to highlight. The first one, and the most important one, is the one on the corner. I don't know if you can see it. It's the detention context that creates ill health. So from a medical perspective, you always think like a doctor or a nurse try to cure a disease. It goes to the root cause. The root cause is detention, but the doctor or the nurse cannot do anything about it. So regardless of what I say, it's important to remember that we cannot prevent the negative impact of detention. What we might, and I say might be able to do is to mitigate, that is reduce the impact, not remove, but reduce the impact. So it's the environment that is the main root cause. And then it's like in any other common case, if you live in a crowded condition, you are more risk for communicable diseases, hygiene-related issues, because more people share resources in that. And then it's quite common in detention as well. Mental health, this is proven across, regardless of the context. It's very likely that in detention, you either will get a new mental diagnosis or it will exacerbate, make it worse, your existing condition. More or less for sure, regardless of the context you take. And then you have children, and especially in contexts where there is no legal limit, there are children born in detention, living in detention for many years, and their cognitive capacity is highly diminished. And the impact on detention on children is, depending on the context, 3 to 10 times higher than on adults. And the impact in many cases, it continues even after they are being released. And healthcare, it's often not need-based. It's based on the rule, not based on the need. And that's a big challenge connected to it. The one thing I want to highlight is that the longer you get detained, higher the impact is. It's another way to show that picture. So this is a study I did in Sweden, and these dots are individual detainees. And this is a score how you measure mental health. These are the number of days. The longer you stay, poorer your mental health. And this is also another universal truth in detention, regardless of how fancy it would be. It's like a cage is a cage, even if it is made out of gold. It doesn't make much of a difference. And again, don't worry about the big numbers. One of the studies I did was looked into what are the various factors affecting the quality of life. This is a combined indicator, quality of life. I looked at the typical ones, like I don't understand language. That's a big impact on my health. I don't get the food I need. I don't like the food. That's a big impact on my health. So we have two such factors, the language and then the food. And then I also looked into how does the staff impact the detainees. Not surprisingly, it's a support that got from the staff is positively associated. It means if you get better support, your quality of life improves. Which then leads to my last slide, I hope so. What could be done? Again, there are a lot of points you can mention and discuss here. I'm not going to go through all of it. But the main thing as I start the last point, if we want to do anything detention to make it, if possible, more humane, to mitigate is this point. I don't know if the red light is coming on. It's somewhere. The staff. Give proper training for the staff. In the Swedish context, previously, there wasn't much training, maybe a couple of days, even less than that. One of the projects I did was with the migration agency. Now they have a 3 weeks or 8 weeks training program. Because again, going back to the idea, like the physical structures are there, but if you are locked up, it doesn't matter how fancy the place you are locked up. We would also feel the same. So it's the environment in there, which is mainly dictated by the staff, that creates a bigger difference. And also, we also would like to think the staff are the villains in the drama. My experience, they're not. I mean, of course there should be, probably there are, but predominantly they are not. So they also need support, even mentally as well, the psychosocial support. It's their daily basis, they get to see this and support them. So it's also important to support them. And then we have the other common things in any sort of restricted environment. The monitoring should be allowed. NGO should be able to give access. Prison-like characteristics, all studies show that that's impact a lot. And then this I said, I will not mention it before, but it's still the alternate detention. You should try not to detain people. Really try to use it as the last resort. I'm going to stop here just to give that The presentation I give so far is from a Euro perspective, from a Eurocentric perspective. But this is an example from Libya. I'm not gonna read it. You can read it if you feel like. The first one sort of says that how they are forced to work when they are detained in Libya, and how they were shot and maybe even killed. The second one says about the impact of sexual abuse and violence. Just show that. So as I said, I cannot draw one, say like detention is like this. It varies. Majority of things I said here is from this book, which we published with WHO last year. I have few copies, 4 copies here, but you can also download its online QR code. More than happy to answer any question now, later, or whenever you feel like. Thank you.
Thank you so much. And just one question to you as well before you return to your seat. So quite a clear picture here as well. And by all means, the new direction for the current EU migration policies are moving towards more and larger detention facilities. This is not controversial as a statement. This is what EU at this moment has agreed on. So just from your perspective, both as an academic, but also connected to an agency that is very strong, WHO, in setting normative frameworks, how optimistic are you that your recommendations of using alternatives are actually going to be able to influence EU policies?
I'm thinking, how should I try not to get into trouble? I think it's difficult to choose one approach. That's what my experience has taught me. While whether I as an individual do not like detention, it has its harmful effects. My role as a researcher, if I put on that, has to present facts. And then it's equally important for me to present a fact and in a way that makes sense to the policymakers, because they make decisions based on various priorities. Sometimes it's budgetary, sometimes politics, sometimes other things. So understand that context. So often trying to go into such meetings saying that we understand the context. For example, we were in Lithuania 3 years ago when the Belarusian crisis happened. And it was a time when that country was struck with like caught off guard, and this was their immediate solution. But be there, be present there, say like, we understand. See, there are things you could do, you should do in detention while to make it more humane, but you should move out of it as much as possible. So trying to have that parallel approach, and this is what WHO is doing. It's also a member state-driven organization. So we try to often work with two-pronged approach. If I'm being optimistic, which I'm often not, we should see a reduction in number of detained places. But all signs, including funding, including research funding, it's actually saying that how can we make it more humane? And this is one I want to start with, like the dilemma you have. Like me saying that we can make it humane, I'm saying it's all fine. No, it's not. But is it okay to ignore? Not either. So I don't have a clear answer, but I think it's something we have to work in parallel ways. One is not, you cannot choose one over the other.
Okay, very clear. Thank you very much, Soorej. And we'll be happy to cooperate, of course, in the years to come. Thank you.